Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. I'm very excited to let everyone know that we're broadcasting the This Just In radio show again live from the HIMSS show floor on Tuesday, March 10th from 1 p.m. Eastern to 5 p.m. Eastern. This will be our 6th year broadcasting live from the HIMSS annual conference, and I could not be more excited. And I want to say many thanks to my radio show supporters through the years: HIMSS, Lenovo Health, Intel, Business Radio X, and certainly Healthcare Now Radio. If you're planning on going to HIMSS this year in Orlando, we'll be broadcasting from booth 2521. So please stop by and see us and join the show live. If you're not able to make the conference, you'll be able to stream us and the radio show again live at thisjustinradio.com between 1 p.m. and 5 p.m. Eastern. Last year we had over 30,000 listeners. There's a lot of fun and certainly a ton of learning. We'll have another great slate of CEO, CIO, leading care providers, industry thought leaders, riveting authors, and certainly policymakers joining the show. Here are just a few confirmed guests: Dr. John Halamka from Mayo, Dr. Rashu Shresha from Atrium, Neil Gomes from Thomas Jefferson University and Penn Health, Anish Chopra, a very good friend of the show, Dr. Karen DeSalvo from Google, Dr. Don Rucker, ONC National Coordinator, Steve Posnack, and the entire ONC policy team. Very excited for them to join us again for sure. So hopefully you'll be able to join us in some capacity, either in person, March 10th at booth 2521 or thisjustinradio.com. You can stream us live. But without further ado, for this episode, my 190th episode, we have a great guest and a very good friend, Dr. Mark Segal, Principal with Digital Health Policy Advisors. Welcome to the show, Dr. Segal.
Justin, it's great to be here today.
Thank you, my friend. And where are you calling in from?
I'm calling from my office in Oak Park, Illinois, where it's clear and cold outside.
Fantastic. Well, I'm broadcasting out of our studio here in Atlanta, and it's a little rainy, but about 62 degrees, and so I'll take it. But I love the cold weather as well, though, certainly in December time. So let's dive in. But also, just so my audience knows, I think this is the first time that you've actually joined the show, correct?
It absolutely is, and I'm really happy to be here today.
Thank you. Mark Segal is one of the most wisdom-filled executives and experts in healthcare and certainly in health policy. He's been a great friend and collaborator of mine. We were talking a little bit off air, but I think since 2008, we've worked on the Hill together, and we've worked across the industry together. Our companies work together. And you're just a great guest. I'm a little ashamed that this is the first time I've had you on air. So I'll apologize for that, but I'm very excited to talk to you today.
Well, better late than never, Justin. So thank you.
Perfect. So let's dive in. What's going on? And I would love it. I have not stayed as close to the healthIT policy as I probably should. So I'm excited for this show just for that specific reason. But give us the latest on CMS and ONC interoperability proposed rules, one of the hottest topics in the industry.
Yeah, so there are two companion proposed rules. They came out, you may recall, Justin. They had sort of a little early appearance at HIMSS earlier this year from CMS and ONC. Both are now at the Office of Management and Budget. It's the part of the White House that does final regulatory reviews. We're expecting them to be published in the Federal Register. The end of this year is, I think, what the agencies would like, but what I'm hearing is it's more likely in early January. The folks at OMB who work these rules, as of, I think, last week, we're still having some stakeholder meetings where people can go in and talk about their issues and concerns with the rules. So the industry is really anxiously awaiting these. These will have major impacts on data access, on what health plans, healthcare developers, HIEs, providers, what they all have to do in terms of data access and interoperability.
So is there any foreshadowing, or have you heard any rumblings, or do you have any gut thoughts on some of the directions they might go, even at a high level?
Yeah. So I think from the ONC side, where the rule is really going to be focused, it's focused on implementing provisions from the 21st Century Cures legislation, which you'll recall passed Congress and was enacted into law late in 2016. The ONC rule is going to implement key provisions around the concept of information blocking, which was basically prohibited in 21st Century Cures, and then also updates to the ONC healthIT EHR certification program to implement some provisions around interoperability. We certainly can expect, and Justin, you saw this over the years, that based on the many comments received, that ONC will make changes. They actually got over 2,000 comments on their proposed rule. Interestingly, my sense is the majority of them were on the topic of price transparency. ONC had asked a few questions about how to address price transparency around the information blocking. So we would expect, changes in the rule. I think in my experience, ONC is very careful about reviewing and responding to comments received. There might be a grace period. I've heard some rumblings about that, where there's some period after the final rule is out before implementation takes full effect. But I'd say one thing I would just emphasize for your readers is it's never too early to start thinking about your own internal planning around implementation of these rules, and particularly compliance, because there are some significant penalties associated with the information blocking piece of it. And then for different companies and organizations, this rule will bring new risks, but also new opportunities, including new business opportunities because of readier access to data. And finally, I'd say my sense is that the scope of this within an organization, whether you're an HIE, whether you're a health IT developer, it could really dwarf what we've seen with HIPAA in terms of the breadth and depth of the staff in your organization who have to basically be focused on making sure that their actions are consistent with the information blocking requirements. So that's what ONC is about. Real quickly on the CMS rule, that was focused more on data access from health plans, and I think we'll see probably a lot of continuity from the proposed rule. The main change I would expect would be some changes around the timing of when health plans have to implement. So that's what we're looking at there, and as we get further, happy to dive a little deeper on some of the aspects.
Sure. And one thing I do want to tell you, just for my listeners, and certainly what is, as it relates to certainly ONC, I feel this is true for CMS as well, but I know ONC actually reviews every comment. So it is very, very important for people to take these rules seriously. Do not be overwhelmed by them or intimidated by them in any way. It's very important that you let your voice be heard. And would they also appreciate saying what's bad? If you read a proposed rule or even a rule, but even proposed rule or any of their questions, if you see an issue, certainly address that issue and say what's bad about it, but also say what's good. If you do see a piece of legislation or regulation or something that they have a purview over, and they've announced it, and you like it, or you feel it really supports your care model, your business model, whatever it is, please tell them, because they want to hear the good and the bad, not just. And we tend to focus a lot on the bad, but we also want to make sure that we're fair and balanced. So.
Yeah, and Justin, I think that is excellent advice. And I think you and I were in meetings where, folks from the agencies made that point. But not only is it just good practice to thank people and to tell them when they're doing something that you approve of, but it's also important not to take for granted that just because something was in there that you like, that it's going to stay in the final rule, because there may be other people who don't like what they proposed. So for all those reasons, it's really important, as you said, to comment on both things you like and should stay, as well as things you think might be best revised a bit.
Excellent. So, and not you mentioned this a little bit. You touched on information blocking, but that's probably one of that and price transparency are kind of one of the biggest topics that I've heard swirling, at least in my stratosphere. So, is there anything else you want to add to from the ONC on information blocking? You probably covered as much.
Yeah.
As you can.
So I think sort of related to the information blocking and somewhat parallel, and a thread that cuts across both the CMS and ONC rules is an increasing focus on using apps, the kinds of apps that we're increasingly used to using on our smartphones and tablets and what have you, and using apps as a way to get access to information, and particularly access to information from patients, consumers, caregivers, etc. The technical way that apps can connect into a healthIT is through a bit of software called an API. And there's a new standard, and again, as you know, we are drowning in acronyms in our field. Yes. But the new standard that's increasingly being used around healthcare APIs was developed by the standards organization HL7. It's called FHIR, all caps FHIR. And so both CMS and ONC are specifying the use of FHIR APIs for that information access, whether it's healthIT developers developing APIs and sort of associated capabilities to enable them to be used for data access, whether it's CMS looking at providers using those enhanced capabilities for what used to be called the Meaningful Use Program that you and I spend so much time on, and is now in part the MIPS program. And then again, CMS as well is focused on health plans using those same standards-based APIs to enable other plans and patients to get access to their information. So that's really a major theme, is using apps to really help the data move. The other key piece of this is when Congress in 21st Century Cures defined interoperability, they really focused on access to all electronic information. But as you know, Justin, not all the electronic information in EHRs and other healthIT is standardized and codified and really suitable for exchange. And so ONC has developed this concept called the U.S. Core Data for Interoperability, or USCDI, which is a data set building on the original Meaningful Use data set that's intended to grow over time and provide a basis for standardizing the kind of information that would be available for exchange, and increasingly to grow that. So we really approach the point when all electronic information and systems eventually can be exchanged.
That's excellent. And that's something in my personal life, that's an area that I spend a lot of time on, is really the app-based exchange for data and interoperability, and it's great, and I love to see the focus here. So, and for those joining us a little late, my guest today is Dr. Mark Segal, Principal with Digital Health Policy Advisors. So, Mark, moving along, what about privacy and security? Obviously, that was always top of mind for us when we were on the Hill. But what are the federal trends right now that's happening with regulation, or any concerns?
Yeah, so it really is a continued concern, and we see things in we see things in the news. There was recently discussion of a relationship between Ascension and Google about access to data. There's always coverage in both professional and lay press about data breaches and things of that sort. I'd say a few of the bigger areas that people are talking about is the fact that a lot of information, particularly information that may be provided, you or I might authorize, gets transmitted to a consumer app, that's outside of the protection of the HIPAA law, which has been around, as you know, for some time, and really governs privacy and security requirements for protected health information. So increasingly, you have health relevant information that's really not been protected and regulated in the same way that the more traditional health information is. And There are folks in Congress that are really looking at that and thinking about, do we need to have broader regulation? The Federal Trade Commission actually provides some level of regulation there, not part of HHS, and that's sort of an area of increasing focus. We're also seeing, and this has been the case for a while with HIPAA, where states, there's variation between the federal law and states, and that variation can be, pretty costly for providers and health IT developers to implement. California recently passed, and I think it's going to be implemented soon, the California Consumer Privacy Act, and a number of states are looking at that. We also have global variation. A lot of the provider and developer organizations are global in scope. So, for example, we have the GDPR regulation in the European Union, and we've all seen a number of little click-through notices that come up on many apps we use, and a lot of that is because they need to align with the GDPR. We also have, even in the US at a federal level, differential treatment for sort of general health information and health information that's related to substance abuse under the so-called 42 CFR Part 2 of the federal code. And so there's just, I think, a lot of concern that you have some information protected, some isn't, and the information that is protected is under different privacy schemes. And so I think there's a lot of interest in taking a broader view of protection of both health information, but also more broadly, personal information that's increasingly seen as vulnerable with the rise of digital and apps and things of that sort. I wouldn't expect congressional action real soon, although there's certainly a lot of activity. We do have a presidential election coming up, but I definitely think that this is an area that we're going to see more and more attention, and ultimately we'll see a revision of how sort of HIPAA and federal law regulates this area.
That's excellent. Good. Thank you. So one of the most recent policies, I believe, or rules that has come out is around price transparency. So can you give us a quick update on that?
Yeah. So the current administration is very focused on using market forces and competition to sort of manage healthcare costs and provide a higher quality care. And one of the key ways that they're looking at, and in some ways this has really been a bipartisan issue, is to increase the transparency of pricing, so that patients really can make, have the information to make wiser, economically grounded decisions about the care they receive, and that to increase competition among health plans, among hospitals, among health insurance providers, to really have more market forces operating in healthcare. So recently, actually last month, CMS issued 2 regulations around price transparency. They had a final rule that affected hospitals, outpatient departments, ambulatory surgery centers, and then a proposed rule really covering health plans. And both of these are really focused on making pricing information available to the public. The proposed rule, called Transparency and Coverage, would require most employer-based group health plans and health insurance, those that offer health insurance for both group and individual, to really disclose their cost sharing and price information to various participants. And the goal is to give consumers real-time access to their cost-sharing information. There are services that do this now, but it's really, it's not as widely available as many would like. Mm-hmm. And then, in addition, the finalized rule, which had a lot of controversy, and I believe the hospital industry is actually suing the federal government, requires hospitals to provide patients with information about their standard charges, to provide this in a machine-readable file, which really interrelates with some of the health IT and digital things we're talking about. they need to display what's called shoppable services in a consumer-friendly manner, and particularly to make public their negotiated charges that they may have with their various payers. So all of this, both the proposed and final rule, really the intent is to make more information available. And then this also begins to interrelate with the information blocking rule we talked about, because one of the things ONC had asked about was, should they make the provision of this kind of price transparency information part of the data that's subject to information blocking? And I think it was that request for comment that got those 2,000 and plus comments. So we're definitely looking at a real focus on making sort of digitally available price information. And this is an area that we're going to see a lot of activity on in the next few years.
Excellent. Well, I mean, I actually helped create a health plan in Georgia, and it's been a great success because we have complete transparency of our costs, and so, I mean, I'm a big supporter of transparency across the board and everything. I know that you have been as well, and the things that we've worked on. I'm not putting words in your mouth, but I just see how transparency has helped so much in getting affordable coverage for me and my family and my friends and my companies and my friends' companies and lots of thousands of people in Georgia. And we're bringing this now to the Southeast. So hopefully we can keep on this push of transparency.
Yeah, a lot of opportunities.
Yes. So moving right along, I know we have some complex topics, but we've got about 4 minutes or so left. But what are we seeing with the FDA regulation of clinical decision support, especially as implemented in the 21st Century Cures Act?
Yeah. So in large part, in response to some provisions in 21st Century Cures, the FDA issued a couple of months ago a draft guidance. This is how they often operate, they do guidance rather than final rules on the treatment of clinical decision support, particularly in terms of what would be regulated and what wouldn't. And you will remember, Justin, and you and I spent a lot of time on this. There was a lot of interest in the Congress on what healthIT should or shouldn't be regulated as a device by the FDA. And one piece of that addressed in 21st Century Cures were criteria set by Congress on clinical decision support that would not be a device and therefore not be subject to FDA regulation. And so there is a draft guidance. Comments are due the day after Christmas on December 26th. That really outlines how they're going to approach that and how they're going to approach regulation for device clinical decision support that may be used by healthcare practitioners or patients. So that's definitely an area to watch. Clinical decision support is increasingly important. FDA also, as part of this, is looking at how they're going to regulate artificial intelligence and machine learning. They've not sort of come up with a final approach there, but they issued a very important white paper last spring, particularly intended to look at situations with machine learning where the system may, basically the algorithms in the system may just change over time as they basically learn from data. And the FDA is looking at using innovative approach to regulation to really accommodate that continuous learning approach. So that's what we're looking at from FDA on CDS and on artificial intelligence and machine learning.
Oh, excellent. That's obviously one of the hotter topics in the industry and a fast
absolutely
area. So thank you for that update. So I just kind of, my closing question almost must be, is around the importance of government affairs strategy, because this is something that you and I focused a lot on. But what are your best practices that you would offer or that you do offer to companies and healthcare organizations in general around why government affairs in the focus?
Yeah, I'd say it's obviously critical in terms of government affairs, both understanding regulations that are out there and laws and what impacts they will have on your customers, on your product development, on your business strategy, and also by understanding those potential implications that can help you develop an advocacy strategy to work with the Congress and work with the policymakers. And I think fundamentally what's really important is to have imagination so that you can actually understand how a rule, how a certification criteria approach, might affect your products and might affect your customers. And it's just really important to take a stance and sort of have a culture that involves looking over the horizon and looking around corners.
Yeah, no, excellent. Well said. And I couldn't agree more. As you know, it's very important to know how this industry is evolving, where it's evolving, keeping your finger on the pulse, knowing how it affects you, your company, certainly your customer, your fiduciary responsibility, how it affects your shareholders. So, I know you and I both are strong advocates to have your finger on the pulse, stay engaged. And then also let your leadership. Well, a lot of us have deep thought leadership and expertise. Congress wants to hear that. The White House wants to hear that. ONC, CMS, so the administration wants to hear that. And it's very important in that regard. So, but we are at our close, Mark. Thank you so much, my good friend, for joining the show and sharing your wisdom and best practices and strategies.
Justin, it's been my true pleasure.
And I will certainly have you back. I hope early in the new year. We might even have some rules that we can talk about. But again, thank you very much. And thank you to all my listeners for joining us today. And obviously, please tune in weekdays, 2:30 p.m. Eastern, 11:30 a.m. Pacific to hear our latest shows. As always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you missed any of this episode or want to hear more, all of my shows are posted on Apple iTunes, SoundCloud, iHeartRadio, Spreaker, Google Play, and TuneIn. And also you can check out the new website that we launched at justinbarnes.com. Thanks, everyone. Have a terrific week.